Good afternoon, everybody. Thank you for joining us today. I am County Manager Dena Diorio. I have several items to update you on this afternoon. Joining me today is Public Health Director Gibbie Harris and CMPD Deputy Chief Jeff Estes. I want to thank Richard Hafner, who is providing our sign language services today. First, we are very pleased and cautiously optimistic with the declining data trends we've seen over the last few weeks. The number of positive cases is going down, our percent of positive cases is declining slightly, and the number of hospitalized patients is stabilizing. I think this showcases a few things, starting with what can happen when you proactively to do the most basic things to stay safe. Wear a mask, wash your hands, and wait 6 feet apart. As you know, the Business Leaders Roundtable's Count on Me CLT campaign is in full swing across the county. You see the messages on billboards, radio, TV, in the neighborhoods, and even on the courthouse parking deck. And the numbers are showing that folks are not just seeing and hearing about it, but they're acting on it. And because we see the impact messaging can have, Mecklenburg County will pay to expand the current campaign and extend the campaign beyond September. Expanded efforts include messaging on streaming radio like Spotify, streaming TV like OTT. We'll do additional messaging on social media, Facebook, Instagram, and Tinder. We'll be doing messaging on Telemundo. We will be working on additional grassroots efforts, including working with specific organizations like our faith community and fraternities and sororities. We'll be doing targeted print advertising in magazines like Pride, the Charlotte Post, and La Noticias. We'll also be doing clean graffiti and partnering with CATS to have messages on light rail and bus signage. We'll also be working with the Charlotte Ledger. Next, through the 2 Million Mask Distribution Initiative, we have given away almost 850,000 masks to vulnerable populations, nonprofits, and small businesses. Phase 2 of this initiative will continue to focus on distribution to small businesses. In addition, we will be working with the Board of Elections to provide 200,000 masks to ensure poll workers and voters are safe at all of our polling places. As you know, we have tightened our local Phase 2 order, restricting late-night alcohol and food sales. As you also know, just a few days later, the governor implemented a similar version statewide. And while we acknowledge that most of the towns in the county have moved to the governor's less restrictive order, the fact that it's a statewide effort, we believe, is paying off. While pleased, we cannot become complacent. Even though the trends appear positive, we are not out of the woods yet, and we must keep our foot on the gas and increase our efforts. To that end, we are launching our new ambassador program that I mentioned to the Board of County Commissioners last week. We will start by recruiting 6 ambassadors who will be trained by public health staff to go into the community and help businesses come into compliance and stay into compliance. They will also serve as a resource to assist businesses in getting any supplies they may need. If necessary, we have the capacity to hire up to 16 ambassadors to work in the community. The job description is complete and will be posted today at 4 p.m. Those interested in applying can go to mecnc.gov to apply online. I also want to thank the Board of County Commissioners for launching the COVID-19 Recovery and Resilience Task Force. We are very excited about the coming efforts led by co-chair Dr. Jerome Williams of Novant Health and Victoria Avramovich of Central Iowa Council of Governments. The task force will begin meeting in the next few weeks with the mission of guiding the county out of the pandemic. Before I turn the podium over to Gibbie Harris for a public health update, I want to comment on the importance of completing your 2020 census questionnaire. The U.S. Census Bureau recently announced that all census efforts would end on September 30th instead of the originally planned October 31st. That gives us 30 fewer days to get everybody counted. According to the North Carolina Policy Watch, North Carolina still needs 4 million people to be counted. That's $7.4 billion of federal funding that's at risk per year for our state. Additionally, a 3% undercount of North Carolina children could represent a loss of $330 million over the next 10 years. In Mecklenburg County, only 62.7% of households have self-responded. Census workers were set to start knocking on doors yesterday. So if a census worker knocks on your door, please answer it. Better yet, go to www.my2020census.gov and complete the questionnaire online. And with that, I will turn the podium over to Gibbie Harris. Thank you.
Good afternoon. Just to give you an update on our current numbers, by noon today, we had a total of 22,657 confirmed cases of COVID-19 in Mecklenburg County since March. Our deaths are at 251, and we've got 33 state-reported congregate living sites in outbreak status. As the manager mentioned, our metrics that we are watching closely are moving in the right direction. We now have a 7.5% positivity rate. That's an average over the past 7 days. And if you'll remember, we were running between 10 and 11% for several months. So the decline has happened slowly over the last couple of weeks, and we're hoping to continue to see it trend in that direction. We've seen a decrease in the average number of hospitalizations over the last 7 days, and that decrease includes in our ICU beds, and our ventilators accessibility is in good shape. So again, these numbers are moving in the direction that we want them to move in. They are moving slowly, but they are moving. We are also seeing some stabilization in our social distancing in the county. So while the direction is moving in the right direction, as the manager mentioned, it is not where it needs to be. We still have work to do, and we still need our community engaged and involved in that work. Late on Friday, the Secretary of Health and Human Services issued an additional order for long-term care facilities, specifically for nursing homes and assisted care facilities. That order includes an expectation, a requirement, that all staff that work in those facilities be tested every other week. We are working with those facilities right now. We're having conversations with each of those to make sure they have the capacity to do that testing for all staff, and if not, to help them build out that capacity. We will have that completed by the end of this week. I do want to mention testing again. I believe most folks know that we had a mass testing event weekend before last, which was a bit different than the one we had in late June. We saw half as many people at that testing event, and the positivity rate for those tests were half of what it was in late June. So I want to make sure that people understand that testing is available in our community. They can access testing. We are not seeing any problems with people being tested. We did go through a bit of a spurt where there was a definite increase in the turnaround time of testing. That has come down significantly, and most tests will be returned in at least 72 hours, if not sooner, at this point in time. We want to stress again that employers should not require their employees to be retested before they can return to work. If there is a need, the health department can provide a letter stating that they have been approved to come out of isolation. That's based on CDC guidance. The problem with requiring a test before coming back to work is that some people will continue to have a positive test for up to 2 to 3 weeks after they've no longer got symptoms and can come out of isolation. That means we have individuals who are not able to work when they're not infectious. So again, we ask that that not be a requirement. If you have trouble getting tested, we recommend that you go to the testing site locator that can be accessed on the county website, or to call our hotline number at 980-314-9400. I want to remind people, I think everybody knows that school starts on Monday. Although it is virtual, immunizations are still required for our children, and many of them are way behind in their immunizations because clinics have not been as readily available since March. So we do have a clinic on Saturday at the Northwest. I take that back. It's at the Southeast Health Department on Saturday, 8/29. That's the 29th of August. Please call the health department for an appointment, and that number is 704-336-6500. We are working with our universities and colleges in the area as they begin to bring students back to help them make sure that they have all the things in place they need to have to make sure that these youngsters are coming back into a safe environment. Their plans are good. We're continuing to work with them to strengthen those plans, but we've got to acknowledge that there will be cases among college students. You cannot bring that many people back into our community where we still have widespread COVID and not expect there to be cases. We will see exposures and cases. What we are working with the universities and colleges on are making sure that they have the plans to mitigate those cases, to address them appropriately, and to manage that risk. That will be true for anyone who opens back up in our community, whether it's a business, whether it's our school system, whether it's our colleges. What we have to do at this point is manage and mitigate the risk. As we have heard a lot over the last months at the national level, state level, and even at the local level, that testing and contact tracing is critically important in our ability to manage this infection. But we cannot understate the importance of the prevention message. You heard that from the manager. There needs to continue to be an urgency regarding compliance with those prevention messages and the current restrictions that are in place. Our emphasis in this community needs to be on getting our children back to school and our parents back to work. And if we're going to be able to continue to do that, we need to continue to see a drop in those measures that I mentioned earlier. So please continue with wearing your masks, wearing them appropriately, which means over your nose and under your chin, as well as washing your hands and waiting 6 feet apart. Thank you. I am now going to turn it over to Deputy Chief Estes.
Thank you, Gibbie. I'm happy to be here today to talk about the enforcement efforts up to date, particularly surrounding the alcohol provision of the Phase 2. Before I do so, I wanted to make just a couple of quick points. That since March, I have been impressed and proud of the way that the local government has worked together from the emergency management's perspective, from the county manager's office, the city manager's office, and all the towns within the county to be able to come together as a unified body to ensure that we did what was best from a public health perspective, dealing with a once-in-a-lifetime, hopefully, pandemic. We've seen the shutdown. We've seen, Phase 1 into Phase 2, now into, the restrictions dealing with alcohol as we try to deal with, having some social freedoms while being responsible with our business openings and our wearing of our mask and social distancing. Where we find ourselves now is at in Phase 2 with an alcohol restrictions that we're trying very hard to ensure that businesses are adhering to, while at the same time ensuring that customers are doing the same. Over the last couple of weeks, since it's been enacted, we visited somewhere over 600 of the locations here in Mecklenburg County. We've issued 14, 15 citations, give numerous warnings, and done a lot of education towards businesses. And I want to point out most of which do want to do the right thing and are trying to be, responsible in the way they have operated. We continue to find businesses, however, that are opening, some of which know they're not supposed to be opening, and with those, we're citating accordingly. We would hope that as we get a little, glimpse of some good news, that we would double down and ensure that we would see this through so that we can go into different phases and hopefully return to a new state of normal. So with that, I'll open it up to any questions for myself, the manager, or Ms. Harris.
This is Brett Jensen with WBT. This is for Dena. Dena, multi-part question, so I apologize in advance. When did you, when doing this whole bar situation in terms of sitting at the bar, did you, or talk to anyone about this? And if so, can you say exactly whom you spoke to about doing this? Like who recommended it, who thought it might be a good idea? Because several restaurant owners are that I've spoken to, well over a dozen, have said they've seen their sales drop anywhere from 15 to 20% because no one's allowed to sit at the bar. And so if you spoke to someone, who did you specifically speak with about doing this or recommending this? And did you ever consider, or would you consider doing what South Carolina did? And I know Charlotte City Councilman Larkin Eggleston recommended to you about letting people sit at the bar, but not allowing people to congregate at the bar, as long as they do it in social distancing in terms of sitting. And I guess lastly, I know months ago you said that Mecklenburg County would follow the governor's mandates and his executive orders. Why did you feel it was necessary to go back on that and issue this one?
Okay, so the recommendation for the restrictions at the bar actually came from our health director, Gibbie Harris, and still she can certainly speak to why she made that recommendation. But there was some very definite public health, compelling public health reasons why we went in that direction. Your second question is, can we let people sit at the bar and not congregate? Well, that, again, we're trying to make these orders as clear as we can so that when law enforcement has to go in and enforce, it's clear to them what is allowable and what's not allowable. And so having anything that's not clear makes it harder for it to be enforced, which is one of the other reasons why we went ahead and did that. The reason why we went ahead and did the alcohol restrictions is because you saw the videos that I saw at Ink and Ivy and the other establishment where restaurants were turning into bars after hours, clearly no masks, clearly no social distancing, and we felt very compelled that the only way for us to be able to stop that kind of behavior is to put alcohol restrictions in place, which is what South Carolina did. They put alcohol restrictions in place. However, they didn't go as far as we did in terms of sitting and congregating at bars. But I will ask Gibbie to come and speak to the public health reasons about why sitting at bars is not helpful in combating the spread of the virus.
That recommendation came after conversation with a number of other public health professionals, both at the state level and across the state. The challenge with the bars is that not everyone complies. And if we have consistent compliance with social distancing at the bars, where people come to sit to eat at the bars, and they're not people coming back and forth asking for another drink or congregating at the bars, then it becomes less of an issue. But that's not what we've been seeing in the community so far when those bars were open. And that was the rationale behind the order, to include that in the order. I know that there are some restaurants that are complying with that, were complying with that, and unfortunately they're being hurt by this. But what we were seeing more was the typical bar environment where many people are standing 2 and 3 people deep at bars, and that is just a recipe for disaster when it comes to COVID.
Real quick, sorry, Joe, can you say real quick, who were the people that you specifically spoke with?
I spoke with the state health director and with health directors in several other counties that are colleagues of mine that were doing similar things for similar reasons.
Thank you, I appreciate it.
You're welcome.
Hey, Gibbie, it's Joe Bruno. I know our numbers are declining and we still have about 4 more weeks left before the next decision on the next phase, but I'm wondering what metrics you would like to see Mecklenburg County hit that will determine whether we are ready for phase 3.
We don't have a specific metric at this point. At the national level, the 5% has been thrown out by a number of different people. 5% positivity rate. And some people agree with that, some people don't. I think what we want to see is a steady decline in our positivity rate. What we're seeing in states where they have gotten down to 1% and 2%, that they've been able to open up very effectively in slow, measured ways. We've got a ways to go to get to 1% and 2%. So I want to continue to encourage people to be part of the solution, which is one of the reasons we've been able to get where we are today, is because people are complying.
This is Derek with Fox 46. I have 2 questions. One specifically is for Gibbie, another is for Dena. I'm going to start with a question for Gibbie. What do you think is behind the lower case numbers? Is it only masks? Because it's pretty assumed at this point that social distancing is not necessarily happening, right? We can see it for ourselves when we go out to the stores, but we're seeing a lot of people wearing masks. As far as the question for Dena is concerned, we've heard from a number of businesses who say that the continued shutdown, 5-6 months, going on is kind of putting them at a breaking point, or it's put them past a breaking point, and they are not planning on reopening. Have you heard from a significant number of businesses in regards to this? And they have said that some of the funding that they're getting to help them out is not going to be enough for them to essentially survive. So I'm wanting to hear from the county, at least in regards to what they're hearing from those businesses, as to whether or not, if they've received a significant amount of businesses that are deciding not to open.
So I'll answer the first part of that question. I think masks are having a big impact. We are seeing more and more people wearing masks. A lot of people are complying with the requirement around masks. So I do think that that's a major part of the solution. But all of the other restrictions that are in place and the fact that we've held to phase 2, I think, has also had a direct impact on our numbers decreasing. And as I've said, and you've heard that from others as well, cautiously optimistic that we're going to continue to go in that direction. But we want to make sure that people don't become complacent because the numbers are improving, because it's going to take all of us continuing to stick to the restrictions, to wear our masks. I do believe we are seeing some additional social distancing. There are some places where we continue to have problems, but for the most part, I think folks are complying, and it's our community that we have to thank, I think, for some of these numbers coming down.
Gibbie, it's Allison Kuznets from the Charlotte Observer.
Allison, do you mind if I answer the other question first?
Sure.
Thank you. So let me first say that I do feel for all of those businesses that are struggling through this pandemic. There are a number of businesses that have not been able to reopen. We know who they are. And, you know, there's only so much small business relief that's going to be available. The city of Charlotte has launched a $30 million small business grant campaign. The Mecklenburg County has our small business loan fund. We will be looking to do some additional grants to small businesses outside of the city of Charlotte in the 6 towns. You know, I don't have a perfect answer for that. I have not heard from a lot of businesses, but I hear what you're hearing when people are interviewed on TV and elsewhere. They're struggling, and it's a really hard balance for us to be able to figure out what to do. There's not going to be enough relief to be able to save every small business that's impacted by COVID, and that's not just happening here in Mecklenburg County. It's happening all over the country, and it is very unfortunate. There you go, Allison, you're up.
All right, thank you. Gibbie, it seems like for the past few weeks, we've been at the same testing level of about 3,500 tests average daily in Mecklenburg. Can you talk about what constraints you're seeing that are limiting that number and where you want to see the county headed? I know you had said recently, or in July, the target was to test 12.5% of the population. Do you have a new target, and how many daily tests would you like to see administered in the county going forward?
Obviously, we want to see our testing increasing. What we know right now is, or what we think we know, again, around COVID, and this is from the national level, that as we wear masks, more people are being exposed to less COVID. That means they're not necessarily not being exposed, it's just not as sufficient a dose. And so there's some belief that up to 40% of the people who are positive right now may be asymptomatic. So if that's the case, then we really need more testing of individuals that are not just feeling ill or know that they've been exposed, but that are in environments where they may have been exposed, not having symptoms. So the more we test, the more we know about what's going on in our community, and the more we can mitigate those situations. And so we do want to increase our testing. At this point, we don't know of anyone who cannot access a test. We've not heard of individuals going for tests and not being able to get the tests they need. And as I said, the turnaround time has improved over the last couple of weeks. So I don't have a specific target right now. The last I've heard from the state, again, was at least 5% of our population, which is different than the 12% that we'd been given earlier. So we're continuing to work through those numbers, just trying to make sure that we've got testing available and are encouraging people to access a test when they need to.
Gibbie, is that 5% number just the standard moving forward, or is that for the next 30 days, like the state has previously directed?
That was something that they mentioned last week on a testing call. So it's a moving target, and what we're focused on is making sure that we're making it as readily available as we can in our community and looking for ways to expand that. We're developing relationships with new labs. We're continuing to work with our testing partners to see what they can do to expand the testing that they're making available, as well as increasing sites, especially in places where we know the positivity rate is higher. So we're continuing to look to increase regardless of whether it's 5%, 10, or 15.
Gibbie, this is Steve Harrison with WFAE. The CDC has said, in terms of schools going back to the classroom, that 5% is their threshold, that anything over 5 should be virtual, anything under 5, that in-person classroom is safe. If Mecklenburg County reaches that point over a certain amount of period, a week or 2 weeks or a month, would you recommend that CMS look to bring kids back under Plan B?
We are participating with CMS right now to look at potential metrics that can be used to help in making that decision, but I've been clear that metrics alone cannot be the only determinant of whether students are going back or not. We need to make sure that the schools have the appropriate plans in place, that they have the appropriate supplies and equipment in place, and that they have the appropriate staffing in place to be able to safely bring kids back. So there's a number of different things that I think will go into that decision, and we'll continue to work with the school system on developing what that looks like.
I guess, though, just one more from your perspective, assuming they meet those challenges, they have the staffing, they have the PPE, would 5%, would you recommend going back at 5, or you had kind of talked about Joe's, in response to Joe's question earlier, about being more comfortable with a 1 or 2% number. Is that where you would land?
Well, the 1 or 2% number is what I'd like to see ongoing in our community, because that tells us that we've got COVID pretty well under control. I'm not holding my breath on that one right now. I'm just happy to see our numbers decreasing. But what I will say is that I do believe at a level of 5% that if we have all the right things in place, a lot also depends on teachers' willingness to come back and parents' willingness to bring their children in. 5% and having good processes in place and sufficient staffing, I think we could safely bring kids back in for at least part-time. But I also want to recognize, just like I said with colleges, we need to level set here. Just because we've got good things in place to make the environment safe for our children, and just because we have a rate of 5% or less, we will have cases because we still have COVID in our community, and individuals are continue to be exposed, whether they're exposed in the school system and bring that into the school, or whether they're exposed in the schools and bring that back out. We're going to see cases. We've just got to put things in place to make sure that we can manage that as much as possible.
Hi, this is Katie Peralta with the Charlotte Agenda. I had a question for Gibbie. Oh, sorry, I think this would actually be for Dena. Either one of you guys, whoever feels comfortable answering it. How much is Mecklenburg County paying to extend the messaging campaign, and how would you gauge the efficacy of the current messaging campaign thus far?
So the Board of County Commissioners appropriated $500,000 of our federal CARES money for community outreach and communication. So that's the amount that we'll spend on that effort overall. We are measuring the success of the campaign based on number of impressions that we're seeing on social media and other places. And so, you know, you can only look at this stuff collectively. So between the messaging and the masking effort, we feel like that since we started both of those things, we've started to see some positive things happen to the numbers. So if we think those are successful, and we're going to continue to do messaging in the hopes that in combination, we'll continue to see the numbers trend in the direction that we want to see them go. Next.
Hi there, this is Hunter with WCNC Charlotte. This one is for Gibbie. I know that CMS, of course, is not going back in the classroom. Many colleges are. Should colleges be going back to the classroom with the risk of faculty and just college students being older than grade school? And are you concerned that this could create a spike in cases? I know you said you should expect numbers, but could it create further hotspots in our community?
Those are all good questions. I don't know that there are exact answers to any of those, but what I will say is that the plans that our colleges have in place are good plans, and it will take work to make sure that those plans are managed and they are implemented appropriately. It will take the students that are coming back in, the professors coming back in, to make sure that they're complying with the things that the schools have put into place. And it will take our community working with our schools to make sure that students are doing what they need to do when they're out in our community. So I think it's like everything else. I mean, it's an experiment, right? We don't know exactly what's going to happen. We do anticipate there will be some cases, but we also anticipate that the systems right now have what they need in place to be able to manage those. We'll be watching that closely and working with them to make any adjustments that need to be made as they move forward. The decision back, so we just need to make sure that we're doing what we can to support them in that and to make sure that the students and the faculty and the community are safe.
Gibbie, this is Hannah Smith with The Observer. We've seen for months now that people between the ages of 20 and 39 have made up the largest portion of Mecklenburg COVID-19 cases. Now, the late night alcohol ban, may be geared at that age group, but are you worried outside of that late night alcohol ban that people within that age group are still gathering at, say, house parties or gatherings outside of those businesses that fall under that effect? Is that something that you guys have been worried about?
That population has been the most affected population for us in Mecklenburg County since the beginning. That hasn't really changed. And I think part of it is because that population is extremely social. They're out and about with their friends, doing things in our community. Which is what you expect from that age group. Not that the rest of us aren't social, but they are the group that we see more in our community. I think the other challenge that we have with that population is what we've seen nationally is they are the ones who are more likely to be asymptomatic. So there are times when they're with groups of friends and they may not know that there's somebody in their group who is positive because they don't have any symptoms, and it just makes spread easier. That's the one thing we know about COVID is it's extremely contagious and very easy to spread. So again, just reinforce for that group as well as everyone else in our community that we need to wear our masks, social distance, and wait 6 feet apart.
Gibbie, this is Brett Jensen again. I don't know if this is true, but an employee at a rest home or nursing home reached out to me last night and said there's another massive outbreak at another nursing home where people have died. I know statewide we have been one of the worst in the entire country in terms of protecting the nursing homes. And I know I asked you this 2 months ago. I'm going to ask you again. Have we done enough, and are we still doing enough to protect the nursing homes and the congregate living centers?
We can always do more. Right? There's always opportunity to do more, but I will tell you that my staff work, especially with those sites that are in outbreak status, on a daily basis to continue to assess, making sure that they've got the staffing they need, they've got the PPE they need, that they're able to test in the way that they need to test, and that they are protecting the residents in the best way they can. What we do know is once you have COVID in an environment like that, it's hard to contain. You're also looking at a population who has many other risk factors, which makes them more susceptible to poor outcomes for COVID. So all of those things put together create an environment that's really difficult to manage. I will say that all of our facilities have worked with us very carefully to protect their residents and to work with their staff to make sure they're doing what they need to. So we'll continue to do that work. And we're putting extra emphasis on it. We have a whole team of staff who do nothing but work with our long-term care facilities, and we'll continue to do that.
This is Derek with Fox 46. Got a question real quick in regards to the RNC. There was some discussion a little bit earlier this week during the Charlotte City Council meeting in regards to the, I think it was specifically between Ed Driggs and Mark Knuckleton, about the unanticipated numbers of people that might be arriving for the RNC, basically the uninvited guests. Is there a plan in place in anticipation of seeing more than the few hundred people that are expected to be here for the RNC, and how that might be managed in regards to keeping people safe? I know there will be limits as to how many people will be there, but as far as the numbers of people that might be coming into town.
So what I do know is that the RNC committee has communicated with all of the individuals who were planning on being here, which was upward of 50,000, I think. They have communicated with all of them to let them know that if they have not received a specific invitation, they are not to attend. So we're hoping that they will be compliant with that. The individuals who have been invited are the only ones that are going to be accepted into venues. There will be no exceptions. Again, we know that there will likely be some protests and other things going on. We have no control over that. But I'm hoping that the RNC is continuing to reinforce to others that if they were not specifically invited to attend, they should not be coming to Charlotte. We'll take one more question, if there is one.
Please, Allison, again from the Charlotte Observer. Could you talk about how testing criteria, so right now everybody who needs to get tested can be, do you see that eligibility criteria shifting as we get into the fall and people are just getting other types of illnesses, just the common flu or the cold? Do you see you would have to clamp down again on who is eligible to get tested?
We're trying right now, we're working with the state and with the federal government to clarify what the processes are going to be around screening and testing. You know, in the past, especially with flu, if you've got the symptoms, quite often they don't test you. They just go ahead and assume you've got the flu and send you home. The question for the CDC at this point is, should we be testing more for the flu than we have in past years? We know we're going to have other upper respiratory infections, and it's just going to muddle the picture a little bit in terms of figuring this out. What I would like to see, and we're working on that right now, is continuing to expand our availability of COVID testing so that if individuals come in with both flu-like symptoms and COVID-like symptoms, that we can test for both at the same time, figure out what's going on, and that will determine how we address that particular case. So we're working on that right now. The other thing that you'll hear a lot more about this as we move into the fall, is we are going to strongly encourage everyone to get a flu vaccine this year. It's going to be critical for the majority of our community to be immunized against the flu so that we can keep that particular virus under control. Thank you very much.
And Charlotte has acted